Hi guys, this is Dr. Bhupesh from Dr. BKM Institute. Today we are going to do this reading. This reading is very special because this is the kind of a reading that comes in the final exam as well. So please, whosoever is watching this video on the YouTube and otherwise, of course, the guys who are attending the session, this video is going to be very fruitful. And the reading of today's is this. And even if by chance it's not today's reading, but I would love to do this reading because this is the kind of actual exam you're going to have in your finals as well. So kindly be attentive and try to listen how we do it. I will explain you each and everything, that what should be the psychology, that how should your mind behave when the final exam is there. Okay. So first of all, I will read the question. The manual informs us that pressure monitor. And in this, I will cover every important thing. Like I talk about three things always. If you have seen our videos, and of course my students to know it. Grammar, that is the first thing. Active passive, this is the most important thing you can take care of. Adverbs, ly words, all that words, in which I also try to tell you that often, frequently, exclusively, only. There are other words like none, always. These words should be seen very carefully because they help in elimination. So adverbs are very important. These are the words to be eliminated. Degrees we talk about: good, better, best. So the new students like Amrit is new over here. So it's going to be little tricky, but I will try to make it simple. And first grammar, second adverbs, third degrees. And there is one more thing I talk about: modals. May wala option always has the highest chance of being an answer. May, can, whereas must has the least chance. Why? Again, the reason remains the same. Must means strict option, like always. So you try to eliminate it. If I say paracetamol must always work, doesn't happen, neither always, neither must. So that is why must, forever, ly words are supposed to be eliminated. Now let's check out this reading. I will try to be as practical so that you can learn from it. The manual informs us that blood pressure monitor. So my topic is about blood pressure monitor. Okay. Digital automatic blood pressure monitor. Electromagnetic compatibility. With the increased use of the portable electronic devices, medical equipment may be susceptible to electromagnetic interference. Simple, that if we are using automatic monitors or electromagnetic medical equipments, in that case, obviously there would be some kind of electromagnetic interference. This may result in incorrect operation of the medical device and create a potentially unsafe situation. So if we are using these automated devices, sometimes their reading can be wrong because there is interference with our mobile phones even. So if our mobile phone is kept beside it, it can change the readings, and it can be. In order to regulate the equipments of MNC with the aim of preventing unsafe situations, ENC standard defines the level of immunity to electromagnetic interference as well as the maximum levels of electromagnetic emissions for the medical devices. So they have set up some rules for the electromagnetic devices. So when there is a tough line, again, see, I'm telling you everything. When there is a tough line like this, don't read it again. Try to understand the meaning of it. Like I have understood that electromagnetic devices, there are certain protocols, but I don't overread it because in the final exam, there is very rare chance that difficult line would have your answer. So I just read it and I try to understand there is a protocol, how to kind of safeguard your device. This medical device confirms even both for immunity and emissions. So there are devices, medical devices, extra medical devices, which help to immune, which provides the immunity so that our readings do not change. Nevertheless always means however. Some people do not understand this word. This also I teach in vocabulary as well. Nevertheless का मतलब होता है however, but care should be taken to avoid the monitor within 7 meters of cell phones or other devices generating the strong electrical or magnetic fields. So if our mobile phone is producing strong electromagnetic fields, then at least 7 meter it should be kept away. So overall the topic is about that if you are using digital automatic blood pressure monitor, because again my question was, never forget the question. My question was about this, then my topic was about this. So they were talking everything about digital automatic blood pressure monitor, that electronic medical equipment may be susceptible to. So that means they are talking about this equipment is susceptible to all these variations. So you have to safeguard it. Okay. So now the manual informed blood pressure meter is likely to interfere with the operation of other medical equipment. Now, please understand the option one in the final exam because we are so very tense. This simple option can go wrong because normally I say is likely means may. If you will understand the meaning of is likely. So by chance, if you remember, sir said may wala option is always correct. So by chance you get into the wrong option. But you have to read the complete line. This is the first thing we are learning from this reading. Read the complete line. The manual inform us that blood pressure monitor is likely to interfere with the operation of other medical equipment. The topic was medical equipment may be susceptible to electromagnetic. That means blood pressure monitor does not interfere with other equipment. It itself get interfered. Please try to understand. This line is saying blood pressure monitor will interfere with others. No, 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 no. The topic is that with the use of portable electronic devices like mobile phones, blood pressure monitor can get interfered. So the problem can happen with blood pressure monitor. But blood pressure monitor disturbs other medical equipment? No. So the first, you have to read it carefully. So this is the first small incidents where we learn how to do OET reading. Blood pressure monitor interferes with other medical equipment? No. It itself is a medical equipment which gets interfered. So this is oppositely given. Blood pressure meter may not work correctly in the close proximity of some other device. That was the whole topic, that you have to keep 7 meters from and incorrect operation. That means they can perform, may not work correctly, incorrect operation of the medical device and can create a. So if they are in the proximity, proximity is another word that you want to know in the vocabulary. Proximity is say this particular diary is in my proximity, is close to me. So when it may not work correctly, yes, it may result in incorrect operation if it is with other portable electronic devices. So that is what this option is saying. Again, there is one more thing I want to tell you. Should be considered safe to use in all hospital. All word is eliminated. This is what I call strict words. Always. All word is also a strict word. In all hospital environments, all word eliminated. So in the first question only, we have learned very important things. Is likely means may, but the sentence is given wrong. So we have to read the complete sentence. First learning. Second learning, may not correct, may not, may word, may not work correctly. Yeah. All word eliminated. These are the things we have learned. I hope you all have understood because this was the first question. I hope I am not doing in rush. So I just want to clarify whether you guys have understood it or not. Then I will go forward because I want to know whether you have understood or not. Guys, have you understood? Should I move forward?
Yes, sir.
Anybody having any doubt, please, everybody can ask. See, this particular learning is going to be, implied or executed in all the questions. All word eliminated, always word eliminated, may word, consider it as a nice option, read the complete sentence. These all things are important for each and every question. Anybody would like to ask anything?
And no, it's clearly very well.
Let's go to the second question then. Let's go ahead. So now we will do part C as well. Don't worry, but I'm just going through this reading because all the 6 questions are very nice, and they are going to teach us some important and applicable things which is there in the final exam as well. Okay, let's go forward. Just a second. Yeah, I just want to take this pen. My pen has gone somewhere. Yeah. Okay. Now the second question of the day. Okay. The notice is giving information about. Now these questions are like purpose questions. Like, the notice might be giving information about all the three, but you have to pinpoint which one is the overall topic. So the notice is giving information about, okay, NG feeding tubes. Displacement of the nasogastric feeding tubes can have some serious implications if undetected. Incorrectly positioned tubes leave the patient vulnerable to the risk of regurgitation and respiratory aspiration. It is crucial to differentiate between the gastric and the respiratory placement on the initial insertion to prevent potentially fatal pulmonary complications. Now they all are talking everything, each 4 lines are talking about placement, positioning. Insertion and care of an NG tube should therefore be, now this is what I want to teach you. This changes the dynamics of the, according to first four lines, they were talking about ways of checking an NG tube whether has been placed correctly or not. Because all the four lines were talking about positioning the tube, if not positioned, risk of regurgitation, differentiate between this. But now this therefore changes everything. Whenever there is any question like the notice is giving information about purpose, that means they're talking about what is the overall. Therefore, insertion and care of NG tube should only be carried by a registered nurse who has undergone this training. Assistant practitioners and unauthorized never insert this, and assistant practitioners and other unregistered staff must never insert. So the topic was about who should perform NG tube placement. Again, I would like to take your understanding whether you have, because again the question is very simple, but in the final exam it can be a challenge, because they were saying like it should be placed correctly. And there is one more thing with the option A. There is one more wrong thing with option A. Can you tell me, can anybody tell me what is another thing that you can eliminate it with? There is one more
Sir,
thing.
LY
LY,
correctly
sir.
way.
LY word to correctly, but this topic
Sir,
was about,
way of checking not
yes,
given in this.
yes, that is very nice. The ways word. This is the main word. Ways of checking. Now, this is what, they will give you so many hints in the final exam. It's whether our mind is attentive or not. So, are they telling the ways of checking? Not at all. So that makes me further sure that at least in my final exam, my two questions are right out of two. So then I move forward. Are you getting my point, guys? Everything all right until now? Should we jump on to third question?
Yes, sir.
Yes, sir.
Yes, sir.
Okay, now let's go on to question number 3. Okay. What must all staff involved in the transfusion? Now, suppose if I'm sitting in my final exam, guys, suppose if I'm sitting in my final exam, the main important word I would love to notice all and must. Normally, I eliminate these words, but what can I do? This word has jumped into my question only, so I have to be careful. What must all the staff in the transfusion process do? Okay. Right patient, right blood assessments. The administration of the blood can have significant morbidity and mortality. We know that. Following the introduction of the right patient, right blood safety, all staff involved in the trans must be competency assessed. To ensure the safe administration of the blood components to the intended staff, all staff must be aware of their responsibilities in line with the professional standards. So all staff should have competency. Staff must ensure, again, must word is again given, that if they take part in any their competency assessment is updated every 3 years. Not only they should be competent, but also their competency should be assessed every 3 years. All staff are responsible for ensuring that they attend the mandatory training identified for their roles. Relevant training courses are clearly identified. So what, check their existing training is still valid? Yes, they have to be. Now, where was this specific line given? This, all staff are responsible. Mandatory training and relevant training courses are identified. So that means it is the responsibility of the staff to take care of their updation. So check their existence. Attend a course to learn about. It is given, but there is not attend a course. I have a problem with this word. Attend a course to learn about, and there is another new procedures. But yes, when they talk about updation, obviously they are talking about new procedure, but new word is exactly not given. But overall, what I understood from the topic, that they should all have competency that should be updated after every 3 years, and all the staff are responsible for ensuring. So means staff is responsible to ensure that their competency is still valid. So that was the main thing. That is what it was an easy question if we don't get confused. So that is what you have to understand in the final exam. Read a document that explains changes in the policy. Again, nothing like that was given. So I would take it rather in a simple way rather than complex way to do this question. If we get over confused, only then we will do this. This is the most tough question that we will do in today's reading part B. In the final exam, I would like to leave this question in the first round. Again, now it comes to the main thing. I have told you about grammar, adverbs. Matlab, we are discussing again and again. Like grammar, if you say, sir, where did we discuss grammar? The first question, first line was a grammar based only, na? If you read it carefully, blood pressure monitor is likely to interfere with other medical. No, it's going to get interfered. So it is also part of reading the sentence in the nice way. Adverbs, we talked about ly words, all, none, always. Then we talked about degrees. It has not come until now. Now this is a question which is like a very uh, nice question, and I have done it so many times before, when I used to take regular classes. So this question was the toughest of all. Let's pay attention and let's see what's there in this question. The guidelines establish that the healthcare professional should. Okay. Chaperone is like somebody call it chaperones. They are basically the helpers. A patient may specifically request a chaperone, means a helping hand. It can be family member or it can be outside the family member. A patient may specifically request a chaperone or in certain circumstances may nominate one, but it will not always be the case that chaperone is required. It is often means maximum times, frequently. This is adverb. Often means maximum times. It is often a question of, so a patient may specifically request, but it will not always be the case. It is often a question of professional judgment to assess an individual situation. So it's according to situation, professional judgment would be taken. If a chaperone is offered and declined, that means if healthcare professional gives an option of chaperone, and if it is offered and declined, now that is why I teach active passive. Read this sentence. If a chaperone is offered, I don't know whether I should over explain your note, but this is part of my job. Please try to learn it patiently because this is important. Passive voice is only B plus third form. Please understand this. This is forever will take your pain away. You will never have a problem in grammar. B plus third form means B की first form is MR, B की second form was were, B की third form been. Been, was were. So whenever you see was were plus third form or is MR third form, that means it is a passive voice. Now, if you read this sentence carefully, for all the basic learners, if you have good English, you know it already. But if a chaperone is offered by the healthcare professional and declined by the patient. So this is how passive voice work is MR. If a chaperone is offered by the healthcare professional and is declined by the patient, this must be clearly documented in the patient records along with any relevant discussion. The chaperone should only be present for the physical examination and should be in a position to see whether healthcare professional undertaking the investigation is doing what he is doing. So chaperone is required during the physical examination to make sure that healthcare professional is doing the task in a medical way. The healthcare professional should wait until the chaperone has left the cubicle before discussion takes place with the patient. So if you're doing discussion with the patient, healthcare professional should wait. That chaperone should go, then we will talk. Unless the patient specifically requests the chaperone to remain. Unless patient himself says, no, I want chaperone to remain. So in that case, now this is the problem with this particular question. As soon as you read the last line, oh, patient, that means patient is making the decision. So when you read the line, the guidelines establish that healthcare professionals should aim to make patient fully aware of their right. They were not talking about any rights, I guess. Healthcare professionals should evaluate the need of a chaperone that was given. That healthcare professionals should evaluate the need. Yes, it was given. It is often a question of using professional judgment. So healthcare professional should make this judgment. So that was the line. Healthcare professional should evaluate the need of chaperone. Case by case means individual situation.
Individual situation.
So it is often a question of using professional. So overall topic was that chaperone patient may request, but maximum times it is professional judgment. That means healthcare professionals will evaluate whether a chaperone is required. Then additional information was given that he should be present only in the physical examination. Healthcare professional should wait. Then in the last line, it was given unless the patient specifically requests the chaperone to remain. So healthcare professionals should respect the wishes of the patient above else. Now this can be mistaken with the last line. That is the problem with this question. That is what makes this question tricky. Unless the patient specifically says chaperone, so we think that respect the wishes of the patient above all. That is what can confuse you. But then you understand that overall the topic was that ultimately it is often a professional judgment on the individual situation. First of all, healthcare professional will evaluate that whether the chaperone is required. So if it is not required, he will not ask even. So that is the first condition. Then if we ask, then patient can accept or reject. And then if the chaperone comes, then patient can request to stay. But ultimately, it's not the patient who will take the decision because he can specifically request. He can't order anyhow. So the first thing is not to, kind of take the patient's will into consideration. First thing is to make a professional judgment by the healthcare professional whether a chaperone is required or not. So that is how this question becomes. This is a tough question. Again, now when we are at this point, I would like to tell you one more thing about strategy. Out of 6 questions in the part B, we need 5 to be correct. One question would be tricky like this. I don't mind if this question goes wrong. We want 5 marks in the part B. Then 8 question in the part C. 8 plus 8, 2 C parts are there. So if you score 5 and 5, you will score 15. And total passing marks in OET reading that is required is 30 only. See, we have got so much of margin. If by chance you score 4, if you score 4, if you score 4, you still score 12. If you're reading part A out of 20, you score 18, you still will pass. But again, we will not score that bad. At least we will score 2 extra points from here, maybe from the part B or from the part C. So at least we can make it 14 questions in the part B and C. And 16 in the part A is pretty much possible. So that is why I always say nobody can fail in OET reading unless there is misunderstanding that all the questions are important. All the questions cannot be done. Some questions are like, what should I say? They are very hard nut to crack. You need to leave these questions in the first round and you attempt them later on. So when you're doing 1, 2nd, 5th, it's not necessary that you have to do all the questions. If any question is difficult, leave it. Don't waste your time. Suppose if this question in the final exam, you waste your 5 minutes on this question. And even after 5 minutes, you are not sure whether this or this. What is the benefit? This question can never be certain in the final exam. I can't be 100% sure because if I have my final exam, even I would be confused. This line, maybe, but then this line, C option. So I would always be confused. So rather than doing this question, I will say, okay, hey, I leave it. I will come back again. So that is the best strategy of OET reading. You should know your marking. 16 minimum in the part A, that's what we are targeting. 14 minimum in the part B and C, that is what we are targeting in one round. And then you get again a chance to revise all these questions and do them right. So this is the most important strategy of OET reading. To understand and to tell your brain even before the exam, take it easy, do only easy questions first. In all my reading videos, you will understand grammar, adverb. Strategy, I always will say, is more important than even knowing adverbs and grammar. Obviously, you should know it, but strategy is more important. That do only easy question first, so that even the people, even the candidates who are not good enough, they can also pass. This is what it does. So please follow this strategy. I will kind of take a pause before we go ahead and we'll try to mark all the questions, whether you have understood or not. So I'm again taking it to question number 1, 2, 3, 4, that if you have understood all the concepts. Because if you have understood all these concepts, you can't fail in OET reading. I promise. Trust me, you can't. Just follow these concepts, you're gonna be all fine. So I'm just gonna go through all the questions again. In first question, we learned reading whole of the line is very important and you can't miss out. You have to read the complete line, and the complete line along with the question should make a sense. That was the first thing we learned. Second, may word has high chances of being an answer. Must word, always word, all word has less chances of being an answer. We should read these words very carefully. In the second, we learnt about that ways of checking word is not given, even though from the first 4 lines it gives an impression that A can be my answer, but then you see it nicely. Ly word is given, then you say ways of checking ng tube is not given, then you are sure that I am doing C, and therefore word is the most important word we learned from that particular question. Therefore, okay. Now jumping on to next thing. Okay, next third question we did, because revision is very important. We are not, I know this question will not come in the exam, but to make your mind oriented with the right reading approach is very important. So in this, changes were not given. Attend a course, single course was not given. In B, main problem was a article. Attend one course. There was no specific course, particular course that was given. How can I do B? So I will just see whether my training is updated or not. It is my responsibility. All staff are responsible for ensuring word is covering the word must. So this was the point, and then you reach to questions like these. Okay, now let's do the question number 5th, and then we will take a pause. We'll stop this. Now, this is also kind of an interesting question. I don't remember it very well, but this is also an interesting question. The guidelines require those undertaking a medication review. So who will take the medication review? Nurses most of the times, or maybe, you know, uh, you know, enrolled nurses. So the guidelines require those undertaking a clinical medication review too. So if I am taking the clinical medication review, guidelines, what do guidelines guide me? Matlab, what do they want from me? First of all, make the question easy. The guidelines require those means who are undertaking a clinical. So if I am taking a clinical medication review, now I understand there was a medication review means feedback. So there was a clinical medication that was given, so we are taking a clinical feedback of the medications. And if I am taking the feedback, what should I do? Let's see, what should I do? So the question should be made easy in our minds before we jump onto the paragraph, because if you don't know the question, what will you answer? Why would you answer if you don't know the question? Question is the first. If you don't understand the question, then jump on to the next question. Leave this question. We will do this later. Make it simple. Sir, what if I do not understand the question? Do it later. Again, simple. Okay. To give all the patients an annual medication review is an ideal to strive for. Oh, to give all. Now understand this line. Otherwise, this line does not have the answer. But again, it improves my understanding. To give all the patients an annual medication review is an ideal means perfect thing to strive for, is means to work for. Strive other means struggle, but yeah, to work for that. If we try to take all the patients, it is a great thing, it is a perfect thing. In the meantime, there is an argument for targeting all the clinical to those who are likely to benefit most. Our guidelines state that at least a level 2 medication review will occur. So now they are talking about medication, that at least level 2 medication, that means that IE means that is the minimum standard is a treatment review of medicines with full notes, but not necessarily with the patient present. So what is level 2 medication review? That means minimum standard is a treatment review of medicines with full notes, but not necessarily with the patient present. Patient presence is not required. However, the guidelines go on to say that all the patient should have the chance to raise the questions and to highlight the problems about their medications. So what this is saying, that patient whether present or not, it's not necessary, but at least all the patients should get a chance to express about the medicines. and that any changes resulting from the review, and even if you are making any change, then in that case also patient review should be taken, and uh, uh, any changes resulting from the review are agreed with the patient, that even if we are making changes after the reviews, even then patient you have to talk to the patient again. It also states whenever there are paragraphs like this, extra lines normally will not have the answers, but I will read it for you. But overall, I have got that all the patients should be aware. And even if you're making any change, patient should be told. It also state that again also should not have my answer though, because my main line was what was my main line? Just give me 1 second. The guidelines, those Hamed, the what are the guidelines trying and say? But I will read it for you, just not to confuse you, because normally I know from this word also that this cannot have my answer normally, but in final exam I will read it. GP's practices are expected to minimize the waste in prescribing and avoid ineffective treatment. So you have to avoid ineffective treatment, engage effectively in the prevention of ill health, avoid the needs for costly treatments by proactively managing the patients to recovery through the whole care pathway. But again, the guidelines require involve the patient in their decisions. It's simple, yes, they should involve the patients in all the decisions. Consider the cost of any change. Even if I do this, it will cover only this thing, and my paragraph will all go into waste. So one thing like this extra thing cannot have my answer. Even if I think about cost, I will not even read this option in my final exam. Recommend other services and an alternative to medication. They don't want to recommend any other alternative. The overall topic was that all the patients should get a chance to participate. All the patients should know about this thing. And also, if you're making any change, again, that should be agreed with the patient. So involve the patient in their decision. This was not a tricky question at all. It was as simple as anything. Now, the last question of the part B, then we will do at least 5 to 6 questions of the part C. Okay, let's see. This question is the second toughest question, or maybe the most tough question. But I have told you how to do this. So let's see if this becomes easy with the same approach purpose. The purpose of this email is to, okay. Very important question, trust me. To all the staff. That is why fifth question was easy. That's why I did it fast. Now this question is very important. To all the staff. Advisory email. Advisory email. What do you mean by advice, guys? Advisory means? Advisory means
To
there
give
should be
suggestion.
there should be an
Suggestion to
advice
someone.
for the staff, a recommendation for the staff. There would be something that would be reckoned. There is another word, reckon. So don't get confused if you ever read this word reckon. Reckon also means recommend. RECKON. This is also you need RECKON, reckon. Okay. So now they are saying it's an advisory email for all the staff regarding the safe use of opioids. Okay. Okay. In August, an alert was issued. Again, passive voice. Means I don't know whether you noticed this or not, but this comes to my eyes. This is how I have learnt English. In August, an alert was issued by the higher authorities on the safe use of opioids in the hospital. This reported the incidence of respiratory depression among post-surgical patients to an average of 0.5%. Thus, for every 5,000 surgical patients, 25 will experience respiratory depression. So, if there are patients in the post-surgical unit, 25 patients, 5% will have respiratory depression. Failure to recognize respiratory depression and institute timely intervention can lead to cardiopulmonary arrest. Are you getting my point? Guys, do you understand that if there is failure to recognize respiratory depression and if there is no timely intervention, then it can lead to cardiopulmonary arrest. So respiratory depression, if not noticed, who will notice it? Who will notice the respiratory depression? And who will do the timely intervention? कौन करेगा in the hospital?
Staff and doctors.
स्टाफ हम भी तो करेंगे ना, तभी तो ये एडवाइजरी ईमेल स्टाफ के लिए है. So it is important. And a cardiopulmonary arrest is there that will result in the brain injury and that can lead to death. A retrospective multi-center study of 14,720 cardiopulmonary arrest cases showed that 44% were respiratory related. So now they did retrospective study. The people who had cardiopulmonary arrest, they realized 44% had this respiratory depression. That means if there would have been a timely intervention, then we could have saved those lives. And more than 35% occurred on the general floor. Out of these, 35% occurred on the general care floor. It is therefore, now this is the main thing, it is therefore. So if you see, the overall topic was about respiratory depression. They were talking about that nurses have not been able to take care, timely intervention has not been there. So there was a problem discussion. It is therefore recommended. Now this is my line. This is what I want to teach you. Therefore and recommended word. Recommended word means advisory email. Advisory email means this is the purpose of this email. That is why even the first 5 line becomes unimportant for me, not important. So it is therefore recommended that post-operative patients will have now continuous monitoring instead of spot checks. Spot check means timely checks, after 5 minutes, after 10 minutes. So rather than spot checks, there would be a continuous monitoring of both oxygenation and ventilation. So can you tell me what this advisory email is doing? Is it changing the method? Tell me, is it changing the method for the nurses? Come on, guys.
Yes, sir.
Yes. Rather than spot checks, continuous check would be there. So now when you are in the final exam and if you have not learned how to do purpose wala questions, people will simply say report a rise in the post-surgical situations because there are so many numbers. Now there are two problems with this. First problem is these were not the main lines. Second problem, one more thing I would like to tell you, there was not any rise in the post-surgical situation. Rise word means 2009 it was this much, 2010 it increased, it rose. There was no reported rise. First thing, I'm telling you different ways of elimination that if you look carefully, you will find so many reasons to eliminate. There is rise in the post-surgical complications. There is no rise. They just reported this much. They reported this much. There was no rise. So when I see the word rise, something should increase, but there was no increase. They were saying the number was terrible. The number was horrific. It was terrifying, but it was not increasing. They didn't talk about the increase. So that is what makes me feel comfortable when I do OET reading. I don't have one reason. I have two reasons to eliminate a single thing. Reporterize, explain the background to a change in the patient care. Yes, there is a change in the patient care. If I understand the word therefore, if I understand the meaning of recommended, if I read this carefully, that subject is an advisory email, and if I understand the background was given that so many patients die because of this reason, that is why we need to change the patient care. Remind the staff of administering that this was not anyhow reason. So in the final exam, please, this is the last question we are doing for the part B today. Again, if you can understand and can relate what I want to teach you is elimination method, that it would be very hard to find this option. But you can eliminate this. And if you can eliminate this, if your mind works that way, I have to eliminate, then you can reach to this. And then you can relate it to this. That is what I want to teach you. OET works, difficult question especially, works with elimination. Like question number 5 was easy. No elimination is required. It was a direct question. We did it directly. Second question was easy. We did it directly. But questions like this, you need to think otherwise. You need to think with the elimination that this, which out of A and B is not my answer. This is how you think. Rise in surgical, rise to nahi gaya. And also, therefore, words Dr. BKM told me, therefore, recommended advisory, the answer should be in this line. Then I read this line carefully again. Now have continuous monitoring rather than there is a change in the patient care. Was there a background? Yes, there was a story. Then you reach to this answer very easily. So you have to connect the dots for the difficult questions. And if you do that, you score 6 out of 6. And no wonder some of our people give us 450 in reading because they understand this approach, and that is how we do it. So I will take a pause. I will ask you again, how's it going? But I will stop the recording and will take your feedback. This is Dr. Bhupesh from Dr. BKM Institutes. Subscribe and share this video with everyone. Not you guys who will watch on the YouTube later.